share my screen. Um, Please feel free, anyone, if there's any burning questions, I'm happy to take questions while we go. And if there's anything that comes into the chat, Lauren, feel free to jump in and let me know, or if there's any problems with the audio or video or anything at all. So anyway, welcome everyone. I am very, very excited to be here to talk about one of my favorite topics, exercise and movement. But I also understand that when we're talking about exercise and movement, it sometimes can be a little bit like talking to that friend that just, they need a bit of an intervention and you don't know if they're quite ready for it. And so movement, we need to talk. And so this is how to move, how to talk to your body and to move in such a way that you won't make your pain yell back at you. So as Lauren mentioned, I'm Scotty Butcher. I am a licensed physical therapist, or actually up here in Canada, where I'm from, is physiotherapist, but it basically means the same thing. In Saskatoon, Saskatchewan, Canada, and I am a Flowly pain coach, and very, very excited to be part of the team. It's an amazing team to work with. So let's just dive right into it. I want to talk just a bit about some of the intentions that we're going to cover today. And what I'm hoping is that if you may have heard some of this information before, but maybe I'll put a bit of a different slant on things, just gain some insight as to why we have pain, what's the purpose of pain, and how can we learn to look at pain and movement, how we can support our goals with becoming more active. We're going to have a practice today as well, where I walk you through beginning how to engage in safe movement in a movement that does feel painful, to give some movement skills while you're in pain, and most importantly, as part of this, is as we're going, you may have a situation where you have some pain, or you have to change position, you have to lay down, you have to take care of yourself. I want you to focus on that and take care of your needs, whatever they happen to be. So just even take a minute, a few moments right now, and just check in with yourself, check in with your body, check in with your emotions, check in with your head, and just kind of think, what do I need right now? What is there out there? What is it that I can do to support myself? And I would encourage you throughout this presentation to attend to that, to attend to what you need to do. So let's start. Let's get into it. Let's start talking about pain. What is pain? So pain, we know, isn't an indication of tissue damage. This is absolutely one of the biggest misconceptions that we all have when it comes to feeling pain, because we are absolutely hardwired to think that our pain is always coming from a physical issue that indicates some damage, and that is not true. We actually know that the correlation or the relationship between pain and structural damage and any tissue damage you may have is very, very small. There is much bigger correlation with how much emotion and fear is associated with pain and as part of your nervous system than there is with structural damage. So what that basically means is that pain is an alarm. It's an alarm that tunes us into what might be a real or a perceived threat. The threat could be real tissue damage. So yes, you can have pain when you have tissue damage, but it's also possible to have no tissue damage and also have pain, because it could be a perceived threat. So this threat could be, when we're talking about the body, this threat could be something that might be scary, or it might be that you had an injury in that area before and your body and your nervous system are interpreting that as being a threat, even though it might not be currently a threat. So what does that actually mean for us? Let's look at some pain facts. All pain is real. So even though we talk very often about how pain is generated by the nervous system and interprets your nervous system, and your reactive or survival brain interprets the signals coming from your entire environment, including your body and everything around you and your emotions. We know that this is very real. And this is actually how all pain is generated. So even though we start talking about the brain and the nervous system, I want to be very clear that no one here is saying that the pain is all in your head. We're not saying that you've somehow created this pain by not being enough or not doing enough or not thinking the right way. Again, nothing is further from the truth. This is very real, and this is how all pain works. So you're not unique in terms of how pain works, but you're certainly unique in your presentation and why pain is there, and how it's affecting you. All pain is our brains and our nervous system's interpretation of threat. And again, like I mentioned before, it could be real or perceived threat or past threat, even. As I mentioned, you could have a previous injury that your brain will interpret signals coming from that area as a threat. And again, just to reiterate, pain does not indicate tissue damage. Again, it can be in the presence of tissue damage, but it's not always the case, and it's not a direct correlation. So the more traditional way that we think about pain is what we call nociception. And this is just our ception, meaning our ability to perceive things, and noci, meaning adverse or unpleasant. And so nociception is our ability to receive signals from the body and determine that they're painful. The old traditional way of thinking was that it was a very direct relationship. If you stick your foot in a fire, there's a signal that goes up your leg, up into your spine, and then from your spine goes all the way up into your brain. And that is partially true, but it certainly doesn't represent the entire picture of what the pain experience is, because pain is an experience. Pain is not a sensation. Pain is actually closer to emotion than it is to sensation, although it's complicated and comprehensive. And so the newer way of looking at things is that there are so many things that go into our perception of pain and why we have pain. And these can be not just the nociception, not just the signal coming from our body, but includes stress, includes our pain memories, includes our previous experiences and our beliefs, our plasticity in our cortex and other parts of our brain as well. Not just the thinking part of our brain, but also from the reactive part of our brain, the nervous system part that's autonomic or automatic. It includes other things, including our immune system and how we modulate the pain from a cortex perspective or from a brain perspective. All of these things contribute to how much pain we have, including our experiences and our emotions as part of that. Now, because I'm a physical therapist, I like to talk about the impact of physical injuries, because we know that many injuries will lead to chronic pain. Not all, but many will. And many chronic pain individuals will, or people with chronic pain, will have had a previous injury that causes their pain to stick around. Now, that's certainly not always true, because we do know there are lots of situations where pain heals, or the body heals and the pain goes away. And there's also situations where there's no injury and you have pain. But what I'm going to focus on right here is just talking about when you do have an injury, why does the pain stick around? And what's the purpose of what it's doing here? So let's say we do have an injury. Let's say something has happened and there is some sort of an injury. We know that healing is inevitable. Okay? If it's skin or muscle, those tend to heal very, very quickly within the first 6 weeks or so. If it's bone, it takes a bit longer. Bone healing 4 to 8 weeks, and for full consolidation might even be a little bit longer than that. Tendon, ligament healing, even a little bit longer than that. And so 8 to 16 weeks or so, we would see that healing happens. And even with someone with a disc herniation that's pressing on nerves and spinal cords, 80% of those heal in 6 months, and more often than not, all of them will heal within the course of a year or so. There are some exceptions, of course, and this is why in many cases, if your pain is sticking around, it's important to have that evaluated by medical professionals as well. But what happens is pain is meant to turn off prior to the end of the healing process, because pain is an alarm. It's an indication of damage or perceived damage. It's an indication of, are we under threat? As healing happens, the threat goes away because our body is starting to heal. And so then it no longer needs the threat. It no longer needs the alarm to say, watch out, because your body's at that point where it's healing. And you can see here that the picture on the right-hand side here is a picture of someone's spine. It's an MRI of someone's spine. And in 2012, you can see a very large herniation. The white here is the spinal cord. The black here is the disc, and you can see how this disc is pressing onto the spinal cord. There's even another one down here where there's a little bit of a pressure there, but this is sort of the major one. But a year later, without any surgery, conservative management, it healed on its own. This does happen. We do see this a lot. But individuals may find that their pain doesn't go away. The pain will often stick around and not go away if there are other situations and other concerns. Okay, so what this is saying is the typical course. And so I talked about nociception or nociceptive pain. This is tissue damage or the perception of tissue damage early on in the process. Now, there's another type of pain, the pain that we talk about more often than not in chronic pain, and that's called neuroplastic pain. And this is often a situation where our brain and our nervous system have interpreted the signals and the damage and the pain that has happened from the injury, and it has put more meaning on it than maybe it needed to in the first place. Maybe with the injury, there's a lot of fear, or maybe there's some worry about recovery, or maybe the nervous system is just ramped up with stress to begin with. Or maybe there were a lot of childhood adverse events that happened that caused your nervous system to become hypersensitized. Or maybe you work or live in a very stressful, tense environment. Maybe you've had some experiences with trauma. All of these things can ramp up the nervous system, and when there's the combination of a ramped up nervous system with a lot of these emotional aspects in the presence of pain, our brains and our nervous systems pair those together. And so what we can see is often pain will stick around, but it's not because of that tissue damage. That chronic pain can continue after healing because the nervous system is remaining overprotective and sensitive. So pain is like a false alarm. It's like a smoke alarm sounding off without the fire, signaling protection even when no damage currently exists, right? Because it's either healed or it was never there in the first place, one or the other. So this is a learned protective response. The body's pain response is learned and not a sign of weakness or permanent damage. Okay. So this nociplastic pain is the type of pain that we want to be able to look at targeting, because the nociceptive pain will heal. The nociceptive pain is part of the tissue damage that heals. Now, there's some really interesting research and statistics that suggest that even in the presence of a physical cause or a past physical cause that has healed, 90% of all chronic pain is neuroplastic. This is created by the brain and the nervous system as a response to all of the signals that it's getting. And so even when there's a physical cause, the brain and the nervous system will adapt. That's what the term plastic means. Neuro is, of course, the nervous system. And the term plastic means adaptable and changeable. So your brain and your body can adapt even in these situations. And that's good news, because even if you've had pain for a long period of time, most of the time, there's not tissue damage. And even when there is, there's still things that we can do about that.
Hey, Scotty, real quickly, we have a few comments in the chat.
Sure.
Someone here says, my pain started from a minor injury many years ago, and I have constant pain on my shoulder since then. When I do PT, I feel better for a day or two, then my pain just comes back.
Right. Oh, that's so common. Such a common thing because so PT or massage or chiropractor or really any of the modalities and professions that you could have to help with your pain. When your pain is chronic, they can do a great job of creating a sense of safety. And whether that's because they've done the right stretching or the right movement or the right manipulation of the joints or the muscles, all of these things can create safety in the nervous system and can temporarily turn the pain alarm down. But if those modalities and professions were targeting the exact cause, when they did that, your pain would gradually go away. And sometimes that does happen. You get an injury, you go to PT or other professions, and it gets better. Well, that's good. That's what we want to see happen, and what can often happen. But in the case where it comes back, it's just, it just doesn't really seem to go away, then we always have to look at, is there another cause? Is there another reason that this pain is sticking around? Because if it was just a tight muscle or a joint that needed moving, it would get better as you did all these physical interventions. So we look at other things like the brain and the nervous system in what's in this slide here, using the same threat network for emotional and physical danger. And it causes very real similar physical sensations. So these sensations come back. The muscles get tight again because your body and your brain are trying to protect the area. So it's very, very common for that to happen. Was there anything else, Lauren?
No, I think you addressed that pretty well. Thank you.
Wonderful. You're welcome. Please feel free to continue to add in the chat. I personally can't see it, but Lauren will be monitoring as well. I'm happy to answer questions. So the same threat network for emotional and physical danger is true. We know that the same areas in the brain light up, whether we're talking about emotional pain or physical pain on the chronic side, the same areas. And it's very, very interesting because there often is not a lot of difference between the type of pain that we're feeling emotionally or physically. And we often feel our emotional pain physically and our physical pain emotionally. So it makes sense that there's a connection there. Because this is a shared system, they activate the same circuitry as well. And so chronic emotional stress can heighten muscle tension, reduce pain inhibition, or change the way that we perceive pain, and it can amplify the pain, and it'll amplify the nerve sensitivity in and of itself. And this creates a body that's primed for pain even when nothing is physically wrong or the body has already healed. So you might be thinking, well, what about my MRI results? I have something my imaging results, where something that has said, I've got this problem. And I've been told by my physical therapist, my chiropractor, my doctor, my surgeon, that this is the cause of pain. Remember that between 80 and 90% of all chronic pain is not coming directly from a physical cause. Here's a great example of how this can look. This was a study that was done just over 10 years ago now, and they looked at a bunch of people. I'll tell you who these people were in a second, but they looked at findings on an MRI at different age groups. And so disc degeneration in a 20-year-old, 37% of 20-year-olds had disc degeneration. You might be thinking, oh yeah, but these 20-year-olds, maybe they had an injury and they have pain. Actually, this study was done in asymptomatic people. In other words, they had no pain. So they recruited people that had no history of chronic pain, no current pain, and they measured them. And they found these high levels of abnormalities in their system. So we all have these structural changes that occur naturally and normally through aging and just the experience of life. I like to call them wrinkles on the inside. Just like our imaging findings aren't inherently painful, neither are our wrinkles on the outside. So wrinkles on the inside are what often these are related to. Now, we still might get some MRIs or X-rays or other imaging to rule out some very serious pathology, rule out cancers, rule out major problems in terms of inflammatory causes and things that can caused infections. Those things are important to make sure that we rule out with a doctor. But you know, even a finding of a spondylolisthesis, which if you're not familiar with that, is two vertebrae that it shifted on each other. And we often think about that as very serious, and we get told that things like that are very serious. You might even have been told with something like that you need surgery to fuse your spine. There are many cases of individuals, like you can see here, 50% of 80-year-olds have this shift in vertebrae, but no pain. So if it's not the shift in the vertebrae or the degeneration of the facet joints or breaks in the disc, anything like that, then if that's not causing pain, then what is? Remember, the structural changes will generate signals from the body. Now, let's think about signals from the body for a second. What I want you to do, now let's just assume for right now that your pain, if you have pain, that it's not in your little toe. Maybe it is, and I apologize if it is. You can think of a different body part. But I'm going to use the little toe because most people's chronic pain isn't in the little toe. So I want you to think about the signal coming from your little toe right now. Just focus on your body's sensations and think about one foot and think about your little toe. Well, if you think about that, you can actually notice that there's some sensation coming from your little toe that you weren't aware of before. I'll bet you weren't thinking about your little toe until I started talking about your little toe. Okay, that doesn't mean the sensation wasn't there in the first place. It just means that your nervous system hasn't placed enough importance on that sensation to make it consciously aware. So it's still there. The sensation is still there, but it seems safe. Your body and your brain and your nervous system have deemed that sensation to be safe, but there's still a sensation. This is exactly the same thing that happens when we start talking about the sensations coming from our body in the areas that are painful. There's sensations there. The sensations come, but often those sensations are normal sensations that your brain and your body have determined to be a threat. And that can be for a number of factors, emotionally connected in many cases, along with pain memories and past history of injuries and all of these things. So how does this work? Well, we often look at fear as the major impact. And so when we start talking about movement, of course, many people are afraid, even if they won't say, well, I'm not afraid of movement, but they avoid movement. And we'll look at how this actually works and how pain and fear can show up, because it's not always I'm afraid. It can be other things too. But pain sticks around often when there is a threat or a perceived threat or a fear of threat. This causes our body to go into our fight or flight response, our sympathetic nervous system that ramps us up ready to go. This creates a neurological output, which I'll mention in a second or two. That neurological output can amplify the pain. And then the more pain there is, the more fear. The more fear, the more fight or flight, and more neural output and so forth. And this is why chronic pain sticks around. The fear of pain causes individuals to avoid movement. You avoid when you're in pain, you avoid moving because our brains and our bodies and our nervous system assume that movement when it's painful is dangerous. And that's actually not true. And that's what we're going to get into. Fear of movement reinforces the brain's perception of danger. And this cycle reinforces pain. So the avoidance results in deconditioning, increase in sensitivity, and this creates a cycle of escalating pain. So this fear avoidance response is normal. It's logical. It makes sense. You hurt so you don't move because you're worried about doing it. So it's a logical adaptation. It's something that makes sense that we think about, and it's not your failure. You didn't do something wrong. This is normal and natural, but it also creates an opportunity for us as a target. So I did mention this neurological output. What can this actually look like? Because if we start thinking about the nervous system and we think the brain creating and interpreting the signals as chronic pain, we don't often think that this can result in physical findings. Because I hear so many times, okay, I hear what you're saying, but look, my knee is swollen, or my ankle is swollen, or my shoulder, I've got this redness, I've got this muscle tightness. That's real. 100% is real. Absolutely. But this neurological output is a product of the nervous system in the brain and causes real findings like muscle tension, actual tenderness to touch, real swelling, nerve irritation and sensitivity, and restricted movement patterns. These things are all real. And it's part of how the chronic pain cycle works. Remember, though, that these things are designed to protect you. And so if we're fearful of them, then that creates this cycle to continue. It allows this cycle to continue onwards. And this is how, actually, if you think about it, this is how all symptoms happen. I'm going to use the example of something that happened to me the other day. And this is a very real example. I was getting itchy and painful in my palms. And this will happen every once in a while. I'm not really allergic to anything very much. And so my palms were a little bit itchy. I was wondering what was going on. No big deal. But then all of a sudden, this itching went to my face. And my face started getting red and swollen, and my tongue swole up. And I started freaking out, going, oh my God, what is going on? I was looking at, I was thinking, am I allergic to something in the house? Did I eat something wrong that I'm allergic to? And I thought about it, and actually nothing from an allergy perspective made sense that I was getting this allergic reaction. But what happened was I started thinking about what was going on in my mind at the time. And I was very worried about some aspect of work. There was an event at work that went on, and I was stressed about it. And when this happened, I was ruminating a little bit on that, as we do, as is natural to do. And I wasn't doing it on purpose. It's just natural. It just happened. That created these very real physical symptoms and signs that you can see. So what did I do? Well, I did the process of what we're going to do today. I looked at it and said, this is actually okay. This is safe. There's no damage. I didn't swallow peanuts and I'm allergic to peanuts. And that didn't happen. And within an hour, it went away. Now, this doesn't always happen that quickly. It doesn't always work exactly that way. Everybody's experience is different, but this just demonstrates the power that the nervous system has to create real symptoms. If I had swallowed a peanut, it would have done the same, and I was allergic to peanuts, it would have done exactly the same thing because the brain perceives it as a threat. Okay, so what do we do about this? The target is fear. Like I mentioned, fear as an emotion perpetuates the chronic pain cycle. Now, this fear doesn't have to be of the pain itself. It could be. Could be the fear of pain or the movement associated with pain. Could be fear of the diagnosis that you have or an impending diagnosis. It could be fear of worrying about everything, being like, I'm worried about my finances, or I'm worried about my health, or my ability to play with my kids and my grandkids, and all of these things, the fear of the worry, or the fear of the emotions that come along with it. But we don't often look at, many times we say it's not fear that I'm feeling. I'm not afraid of it. I hear this a lot. I'm not afraid of the pain. But fear shows up in so many different ways. It shows up in fighting or fleeing. So this is that fight or flight response. Fighting means I've got to get rid of it. I got to do what I need to get rid of it. Fleeing is I'm going to avoid. I'm going to avoid movement. I'm going to avoid feeling it. Anything that hurts, I'm not going to do. Focusing is focusing on the pain and going, oh, every little thing that I do hurts. I need to focus on what these things are and try and figure it all out, which is one of the other ones, figuring it out. I'm so frustrated. My pain hasn't gone away. I don't know what's going on. Oh, forlorn is, oh, my world's going to end. I don't have it anymore. Fixing. I've got to do what I can to fix it. What's the best exercise? Can you give me the best exercise to fix my pain? What is it? What is that best exercise? Figuring out, we talked about, and then forcing. I'm just going to force through it because I know it's part of this is part of how pain works, and I'm going to just force my way through it. I'm going to feel the pain and just do it. All of these things are a component of fear, and they have fear as part of them. And they are part of what perpetuates this chronic pain. So the irony of the whole situation is the harder you try, the harder it is to actually deal with your symptoms, because you're focused so much on it. Your brain turns that up, turns the alarm of pain up. Okay, so let's talk a little bit about movement then. Why is movement important? Well, this isn't news probably to most people. Movement is incredibly important. As a physical therapist, I prescribe exercise and movement all the time, even though I know that it's not necessarily the magic exercise that's going to fix pain. I do it and because it's very, very important. It's very helpful. But when you're in pain, it's so hard to do. It's so hard to think, well, how am I supposed to move and exercise when it hurts so much? Well, we're going to talk about that. Just two things to remember, two little quips, and then I'll move on. Movement is medicine. All of these things that you see on the screen here, you might go to your doctor and say, your doctor might say, well, you know what, you've got some glucose insensitivity and insulin insensitivity. Well, maybe it's medication. Well, movement is medicine too. We know that the right type of exercise with the right prescription, with or without the medication, depending on your situation, it might still be important, but we know that movement and exercise can contribute to these changes. So movement is medicine. The other thing, what's more important when we start thinking about pain, is motion is lotion. You might have heard that one before. Moving actually lubricates joints. It makes it easier to move. So the more you do movement, the easier it is. But when it's painful, what do you have to do? Well, if we're saying, oh, I have to avoid all the pain, I have to not move, I have to, I'm really worried about it. Part of it is taking that fear and reducing the fear. And that's what we do in Flowly, and that's the approach that we take to chronic pain. So let's think of movement as climbing a mountain. So we see our little mountain climber climbing up to the peak. Now let's say that this is an analogy for how hard you're pushing your tissues. So let's say it gets harder the higher you climb. So at some point in time, when we reach the peak, let's just say that tissue has been damaged. And I have an example that I'm going to show you in a minute. But tissue damage happens when we hit the peak. Now, we're actually going to see that pain starts before then. Pain starts at a point in time prior to the level of tissue damage, because remember, it's an alarm, it's a warning. It's, oh, if you do too much more, it's going to hurt. Okay, this is the normal situation. Okay, this is the point where the pain will protect us, or anxiety or fear of the pain will stop us before we actually get hurt. But we experience pain both before and without tissue damage. Let me give you a little bit of an example. I don't know if you can still see me, but I'll walk you through this. If you can, take your finger, just like I've got it here, and I want you to bend your finger backwards. Don't make it hurt. Just backwards. I used to have so much mobility. I used to be able to touch my finger to my forearm. Well, I'm not a spring chicken anymore, so my finger won't go all the way. But I can push it fairly far here. Now, I've taken it to the point where I'm feeling a stretch. Now, if I pushed it a little bit longer, a little bit further, you guys can all do this if you're feeling confident about it. Push a little bit more. That signal of a stretch is getting more intense. And I might at some point in time say, actually, that's starting to hurt. I might call that pain at some point in time. And probably the longer I stay here, the more it starts to hurt, or the more I would say there's pain. Okay, so the question that I want you to ask yourself as you're doing this is, have I damaged my tissue? Have I done something to tear my finger? Well, let's gradually bring it out, nice and easy, wiggle the fingers, and just like magic, lo and behold, oh, okay, well, it feels a little sensitized right now, but I don't think I actually damaged anything. Okay? This is exactly what happens in all injuries. You sprain your ankle. Now, this happens very quickly. It's just like what we did, but it happened so quickly that there wasn't enough time for pain to stop you. Okay, so then you damage your tissue. So, but the point here is that pain happens prior to and without tissue damage. And then tissue damage can happen, and of course it's going to be painful. But where we want to go with this is to look at what does that mean in terms of movement with pain. So if pain doesn't indicate tissue damage, but it's trying to protect us from damaging tissues, then we have to look at, well, when does it come on and why and how? So this is the situation that we just talked about. We talked about climbing the mountain. We have an area where pain starts, but it's well before the point of tissue damage. What we look at, and we call this area the how much nervous system sensitivity you have. So if your nerves are very sensitive, you'll actually get more pain a little bit earlier. And if they're less sensitive, you'll get a little bit later. But this is important because we haven't had an injury in this case, let's say. But this area is where it's pain-free, right? It's below the level of pain. And we want to be able to climb the mountain because climbing the mountain is good. We already said motion is lotion and movement is medicine. So we want to be able to do some of these things. So before an injury, lots of things we do are going to be pain-free. And when we do hit pain, we go, ooh, maybe I shouldn't do that. So then it's very easy to think that when we do have an injury, uh-oh, maybe I shouldn't move through pain because it's indicating damage is about to happen. But actually, what happens is the nervous system gets more sensitive when you have an injury. So if you have an injury, the tissue tolerance might decrease a little bit because you've damaged some of the tissue. You've done, let's say you've got a chronic shoulder issue, a rotator cuff issue. Let's say that was what it was happening. Or maybe you have back pain. Maybe your imaging showed a disc herniation or something like that. So you have maybe a little bit lower tissue tolerance, but it's certainly not as low as we think it is. It's our tissues adapt. And especially if it's been a few months, we know that healing has already happened. But that doesn't mean you don't feel pain. Remember that if the nervous system becomes more sensitive, instead of having this line where pain happens at the same amount of nervous sensitivity, we actually get that down here. So the pain happens much earlier in a sensitized nervous system, but it's still well before the point where we're actually damaging tissues. So after an injury, it's important that we start thinking about, well, what do we have to do to try and adapt? If motion is lotion and movement is medicine, then we need to do some of this. But if we're spending all our time at base camp and we're not climbing the mountain, then this tissue tolerance just is going to keep going down and down and down, and you're going to get weaker and weaker and weaker. This is what will happen with pain over a long period of time. So what we need to do is we need to say, okay, what is a safe way to proceed with movement through some pain, with understanding what is safe pain? So we know that gentle, safe movement sends signals to the brain indicating that the body is not in danger, reducing the perceived threat and eventually reducing the nervous system sensitivity. Movement as what we call a bottom-up approach complements a lot of the other approaches, the cognitive approaches and the coaching and the therapy approaches, like education and reassurance. But what movement can do is it can actually retrain the pathways in the brain, that neuroplasticity, which recalibrates the nervous system's threat response and can bring this up, which is exactly what we want to try and do. All right. So what I'd like to do at this point, I'll just check in to see if there's any questions, but then I'd like to take you through a structured practice of how to move when you're in pain, and how to do though in such a way that your pain isn't going to yell back at you. So Lauren, is there anything in the chat that we should address, or any questions that anyone has?
No new questions.
Wonderful. Good. Okay, so let's carry right on through, and please feel free to participate if you'd like. It can be very helpful to go through this, and but also if you're not feeling safe, if you think that there's something about this that you're not ready for, then, or that you're unclear about, then absolutely listen and learn if you'd like, but you don't have to participate if it doesn't feel right to you. Okay. So let's do this in a slightly meditative style. So what I want you to do is I want you to find a position that's relatively comfortable, but think about how you're going to move your body. And so what I want you to do is I want you to think about an area of your body that is painful, maybe hurts to move, but isn't the worst pain you've ever felt in your whole life. If you're a 10 out of 10 right now, now's not the time to be doing gentle movement necessarily. There's probably some other things. But if you're less than a 10 out of 10, then, but still significant, then this practice can be very helpful. So thinking about a position that allow you to move the area that you've chosen that's painful. So if it's painful in your back, you might be lying down or sitting, and where you can do a little bit of back bending. You might be sitting if it's a shoulder, or leaning over, or something along those lines. So finding a position where you know you can move, and then just get settled. What I want you to do, if it feels safe to you, I'd like you to let your eyes close or let them soften. Soften your gaze, maybe lower your gaze, or if you're feeling confident, comfortable, close your eyes. As you do that, I want you to just think about all of the sensations that you're feeling at the moment. Everything coming in, not just the painful areas, but everything. The sensation of pressure of your body on the chair or the floor or the bed or the mat, wherever you happen to be. And just notice, just feel the feelings, the sensations that you're getting. Notice the clothing, how that feels on your skin, the hair on your head, glasses if you're wearing glasses, shoes if you're wearing shoes. What do those feel like? And then as you're thinking about all of these sensations that's coming, what I want you to do is I want you to turn your attention a little bit inwards now. Turn your attention to something inside you that feels relatively safe. For many of us, it's our breathing. For some of us, if you don't feel comfortable thinking about your breathing or focusing on your breathing, then focus on some other sensation. Focus on maybe the feeling of your heart beating or the sound of your heart beating. Or maybe it's the movement of your belly. Or maybe it's just the sensation of your stomach gurgling because you're hungry. Any sensation that's inside that doesn't feel threatening. If it is your breath, I often will use breathing, if you feel safe with breathing, to feel that air going in and out, and feeling the sensation of your chest rising and falling, or the air moving through your nostrils or your throat. And just really thinking about some relaxed, easy breaths that bring oxygen in, the life-giving oxygen in. And then if it feels safe to you, you can think about just relaxing on that breath out. Just as you take that breath out nice and easy, allowing any tension to come out. And just noticing how you're feeling as you attune to these sensations. So now what I want you to do is I want you to think about how in the position you're in now, no matter what you feel, no matter what the sensation, you are in a place where you're not going to be injuring yourself. You're in a place where you're not going to create a problem. You're not going to, it's not where you're not doing any heavy lifting at the moment. You're not doing extreme ranges of motion of stretching. You're not lifting something you shouldn't lift. You're not doing something where there's going to be damage done to your body. You're in a safe, comfortable position, even if you feel discomfort or pain. The position is safe. And so I want you to, if it feels right to you, to just say to yourself, okay, I feel this sensation, but this sensation is safe. This sensation isn't causing damage right now. I feel it, but it's really just a sensation, just like that sensation of your little toe. It's just being misinterpreted by our nervous systems and our brain. Because we're not moving and doing things that are going to hurt us at the moment, it's not going to be causing damage. But if you feel pain, that's just an indication of that alarm. So say to the alarm, even picture yourself going over to the alarm and saying, okay, I'm going to turn you down. I'm going to turn the alarm sound down because it's okay. I'm safe. I'm not going to get hurt in this position. Just remembering the breath as you're doing this, and or the other sensations that you feel inside the heart or the stomach, anything at all that you're feeling that feels safe, and just come back to that at any moment that you need to. Now, what I'd like you to do is think about the area where you have pain, the area that you've chosen that you're going to do some movement. And I want you to think about, what would safe movement feel like to you right now? Would it be just a tiny little movement back and forth, a little oscillation? And then just see if, while you're focused on the internal sensation of breathing or the heart or the stomach, see if you can just gently start moving. Not big movements, think like 10 to 15% of your movement capacity in that area, your range of motion. Very small, very easy. Now, you might notice that your symptoms change, and that's okay. Remember, we're not doing anything. We've purposely chosen something that is not going to cause us damage. This increase in pain is not because you're doing damage. We're well within that limit of tissue tolerance. So it's okay. It's okay to feel this. If you find yourself at the point where you're freaking out about it, then back off. We don't want that. We don't want you to feel so much that you don't feel like you've got it handled and you understand what it is. I want a little bit of discomfort, not a lot. So through this movement, with the little bit of discomfort that you're feeling, keep saying to yourself, I'm okay. This is temporary. This is actually safe movement. Movement is good for me. Movement is medicine and motion is lotion. And I want to be able to do these things. So the alarm doesn't need to be there. Tell yourself you're okay. Say this movement is safe. And if you ever need to, return back to that internal sensation of the breath or the heart or the stomach or anything else that feels safe. But if you're feeling like this is going okay, the pain hasn't increased too much, continue with the movement, the gentle oscillations. Feel free to take a break if you need to. Breaks are fine. There's nothing wrong with taking breaks. If you have to take a break, don't beat yourself up about it. Some people say, oh man, I could only do a certain number of repetitions or a certain amount of time before I needed a break. That's okay, especially if this is something you haven't done for a while. You do need breaks. Give yourself a break as needed. Return your thoughts back to that safe internal sensation until you feel like it's okay to try it again. And then start again. Nice and easy, nice and gentle, calm, safe. You're okay, even if there's some pain. You might be wondering, well, how much pain is too much? Think of a traffic light. Green is you're a-okay no matter what you do. I don't feel really anything, or it's so small it doesn't matter. Like a 0 to 2 out of 10. Yellow, maybe from a 3 to a 5 or a 6, is kind of in that middle zone where it's like, okay, all right, I think I can do this. But, my brain's telling me and my nervous system's telling me to be careful, just like a yellow traffic light. So kind of in the 3 to 6-ish range. But I feel like I'm okay. But if you start seeing that discomfort creep from a 5 to a 6 to a 7 to an 8 and so on, then that's probably an indication that your nervous system isn't ready to handle this at this moment. So then just back off until you get to a point where it is in the yellow range. So you might be continuing this movement as I've been talking. It's okay to take a break if you haven't. But if you're feeling okay and it's safe and it's easy, only if you think that you're well into the yellow, nowhere near the red, you could increase the range of motion a little bit if you like. And this type of practice, you do exactly the same thing. Increase what you're doing, try and do a little bit of movement, remind yourself that you're safe, that you're not doing anything that's going to cause damage. This isn't going to hurt you. It might hurt, you might feel pain, but there's no harm to your tissues by doing this. So you're safe. It's okay. This discomfort, this pain that you're feeling, the sensations you're feeling are safe. So allow them to continue if you feel you're okay. Then just to wrap up, we can find ourselves where maybe we're bringing ourselves back to a little bit of stillness. You can stop moving the body part and start thinking about the sensation inwards again, the breath or the heart or the belly. Find that safe sensation. Once you've found that safe sensation, just revel in, just be happy in the point where, you've done some movement, you've done something positive. Motion is lotion, movement is medicine. You've done something that maybe you weren't as comfortable doing before. And you've done so in such a safe way that it's turning that alarm bell down. It's turning that fear alarm down. And the more we do this, staying in the yellow traffic light, the more we do this, the more we rewire our brains to be able to understand that this movement is safe and the signals coming from that area aren't a danger. Just breathe in a couple more breaths, knowing that you just did a great practice, wonderful practice for yourself, and that you've learned a new skill that you can take forward to help you reprocess the pain and the sensations you feel with movement. The movement doesn't have to yell back at you. Now, when you're feeling comfortable, wiggle your fingers and your toes if that feels good. Give your shoulders a movement if that's something you want to do, or whatever feels natural. And then when you feel like you're doing all right, you can open your eyes. So that's a brief practice of how I would get someone into starting movement in an area that feels not so safe. That's one way that we can do this. And I hope that this has been something that you can use moving forward. It's certainly a type of method that I use in my coaching to allow individuals to learn new movements and to learn how to get back into things, creating that sense of safety. So I'm going to stop sharing right now, and I would like to go into a bit of a reflection or even a discussion and a Q&A. And my first question for you is, if you participated in that practice, how was that practice for you? Any reflections, any challenges, anything that you want to report? And if there's nothing, that's fine. There's no pressure here, but you could even think about that yourself. And if you have any questions or discussion, I would be very happy to take questions at this point. Mike, I see that you've written it, said it feels relieving. That's amazing. That's what it should feel. It should feel like you have a little bit more confidence, that you've reduced that fear dial down a little bit, knowing that this is actually going to be okay to move. I love it. Anything else? Anyone else? Any other questions or comments?
I'll chime in, Scotty. This kind of makes me think of something I had a client say to me recently, or a hero say to me recently, especially with your phrasing around our pain yelling back at us. A hero really talked about how they really valued your movement exercises. Scotty developed some really excellent movement exercises that we were able to incorporate into our program, and it really helped combat some fear that this hero had around movement. And they really came to frame their pain as not really the enemy, their pain being this force that was giving them information about what was going on. So their pain became this cue that, okay, maybe, you know, I've packed my days to be a little bit more stressful than I need. My pain is this sign that something's going on rather than this thing that is my enemy or that I need to try to avoid, as much as I can.
Yeah, amazing. I love that reflection, Lauren. And I do hear that so often where people will start to realize that pain is just information. It's just your nervous system and your brain and your body trying to talk to you. Your nervous system and your body, they don't understand, they don't speak in English or in whatever your native language is. It speaks in symptoms. Your body speaks in symptoms, and it's trying to tell you something. And the more you recognize that it's not the enemy, the more you start to go, huh, that's interesting that you're here. I wonder what you're trying to tell me. The more you can do that, the better off things end up being, and the safer you start feeling and understanding why the pain is there.
Yeah.
I love the comment in the chat here from Mike, is that able to move more than usual pain, fluctuated between a 7 and a 3, and that's amazing. And that's typically what happens when we can find a way where we take our nervous system and bring it down a little bit. It allows us to be able to move a little bit more freely with a little bit more confidence, and that can help rewire the brain. Now, the comment that Aaron, you've mentioned here, nice exercise, but still a little nervous. That's totally normal. That's completely normal to be nervous about movement. The cognitive piece, the thinking piece. I love that you mentioned the mountain image helped you think about it differently. And yeah, it does take practice. Absolutely. It takes practice to do this, not only to get used to the idea, but also it's almost like convincing and providing evidence for your brain and your nervous system that this is the right approach. It's evidence that, wait a minute, this can actually be okay. I could actually do this. And over time, sometimes that alarm bell will turn down quickly, and sometimes it takes a long time. Everybody's different, and there's no right or wrong. There's no right way. There's no right speed. We don't say, oh, you should get better in X number of days, weeks, months, anything like that. It's about how quickly or how well can we heal what our nervous system is trying to tell us, and what our nervous system and our brain and our symptoms are trying to do for us. The more we can heal that, the better we deal with that, then that's when you'll notice that difference. So it's okay. It's absolutely okay to be nervous. 100% okay to be nervous. And that's where we can help you. This is where the Flowly coaches can really dive into things and help you understand, when you should be nervous and when you shouldn't. And most of the time you shouldn't, but we can help decipher that for you. We can help you, guide you in the right way if you're unsure. But it does take time. And thank you, Nure, for the comment as well. Yeah, we don't often think about when we stretch and move. We don't think about the way it is. I'm a big believer that when we're exercising, really tune in. It's a great time to tune into what our bodies are trying to tell us. Anything else, anyone? If you're listening to this recording and you have questions, please reach out to the team. We'd be happy to help. Either one of the coaches or one of the staff can respond and help you and help guide you through some of these practices.